So if we start to think about how can we predict who will respond to these therapies, we find it very difficult. Some of the usual parameters that predict for response or lack of response in lymphoma don't seem to be associated with lack of response or response in CAR T-cell therapy for lymphoma. One of the things we're trying to do is figure that out. Here at ASCO this year, we have several presentations that are looking at ways we can start to predict early on or at the time of CAR T-cell therapy who might be less likely to have a durable response. And just to highlight, we're looking at the amount of tumor burden in patients who are treated with axicabtagene ciloleucel. The 50% of patients who had higher tumor burden were responding, had much longer durable responses than the 50% of patients who had low tumor burden. But those durable responses were still seen in about 30% of patients. So I think that what's really important in here is that the amount of tumor that's there can correlate to durable remission. And actually bridging chemotherapy might be able to shrink down tumor in these patients and actually improve outcomes. But that has to be tested prospectively. One of the other really interesting findings here at ASCO, we looked at minimal residual disease as measured in patients who had gotten CAR T-cell therapy, and we find that at the 28-day time point after infusion of CAR T-cell therapy, looking for minimal residual disease very nicely stratifies patients into long-term responders versus those who are destined to progress. Even in patients who've had a radiographic response, we can pick out who's very likely to progress.